So the lower patient, we are going to do the upper jaw. The lower full mouth.
Yes.
If you see here, there is good alveolar bone is there. Till that this bone is called alveolar bone. Till the root apex. Above that it is the basal bone. But here, from 1-3 situation is okay. The alveolar bone is present, but from 1 to 1-1
There is no very
one
less.
is 2-3 till the root apex. Even in premolar molar area, even beyond the zygomatic buttress is at the level of the crest.
Yes.
So severe bone loss, even the basal bone is gone. So how to rehabilitate? So before that we will discuss few things. There is something called C1, C2, C3. This is a sinus. C1 means crestal cortical. This bone is called crestal cortical. From where and all our implant can get stability. The C2 is also called second cortical. Or opposite cortical. The nasal floor is that C2. Okay. This nasomaxillary buttress is another C2. This anterior wall of sinus is another C2.
Yes.
The sinus floor is another C2. The posterior wall of sinus is another C2.
Yes.
And here, palatally bone will be there. Palatal bone is also cortical. That is another C2. So anteriorly we have got nasal bone or nasal floor and palatal. And here this bone is cortical, right? This is nasomaxillary buttress and anterior wall, sinus floor. Sinus floor is not a very great cortical. It is not very good. Posterior wall also not very good. But other bone is okay. So placing implant and getting engagement from this C2 is the most important thing. Because many times the crestal bone will be bad, will be resolved. So we need a longer implant to reach this C2. So our duty is to find where the C2 is present, where the C2 is hiding. So that place the implant close to or engaging the C2. Your job is done. So what is C3? The area away from maxilla and mandible. That bone is not present in maxilla and mandible itself. But we are placing the implant there and we are getting C2.
Yes.
Example? Zygoma. Zygoma and pterygoid. So one is pterygoid and another one is zygoma. Zygoma is out of question. Okay. But pterygoid all can do and should do. It is a very, very important armamentarium in full mouth rehabilitation.
Zygoma it's not it's more technique sensitive.
It's more. It needs more expertise. Skill. So it's close to the eye. A lot of things are there. Okay. So for 2 years we never did any zygoma. Previously we used to do a lot of zygoma. But after we started using that MU implants and titanium bar and certain surgical techniques we improvised. So after that we never needed zygoma. You can avoid zygoma by proper planning and the use of multi-unit implants. Okay. So within a 1 year frame we placed 160 to 180 zygoma implants. But after that we didn't do even one zygoma. Okay. By careful planning we can do. So this patient, so SEC classification, this patient is the maxilla is complex. The lower is almost between S and A. Except that left distal mandible is out, but that is okay.